And that may be affected by a different disease. For instance, some patients smoked during their use, and they may have COPD or emphysema, which may affect the other lung. So it may not be exactly 50% of the ideal lung function. So it really drops your lung function quite a bit and causes, in that context, your functional status to potentially deteriorate, and in some situations, patients to be left with a functional status that would be very difficult to maintain their quality of life and potentially require oxygen. And obviously that's one of the things that we try to avoid by selecting patients appropriately when we decide what surgical procedure they are subjected to, that we actually really try to preserve quality of life as best as possible and preserve lung function as much as possible with these surgical procedures, and try to do this in a proactive fashion where we actually try to select the right candidates for the right surgical procedure up front. Because in contrast to extrapulmonectomy, pleurectomy and decortication, the competing surgical strategy is designed to preserve the lung, and therefore patients actually typically end up with more lung function at the end of the procedure.